know that cognitive decline affects millions annually, but proactive steps can support brain health at any age. Tonight, we'll explore how you can take charge of your brain health with practical strategies and exercises. Hi, I'm John Mayer, Director of Neurologic Rehabilitation at Buffalo Rehab Group, and I'm joined by neurologic occupational therapist Mary DiGiacomo to discuss how you can enhance and protect brain health. Whether you're here to support an aging loved one or improve your own focus or are recovering from a neurologic condition, everybody's starting at a different point. Tonight's tips are adaptable to fit your needs. Remember, while tonight's class provides some general education on actively improving brain health, always consult a healthcare provider before trying new exercises. Feel free to drop any questions you have in the live chat. We'll answer them during our live question and answer at the end. Now let's get started. All right, so let's get right into it. The brain is a very complicated organ, but fortunately for us, there's a few basic things that we can focus on that can improve it. The brain's responsible for your cognition, or how you're thinking or processing information. It's also responsible for working with your balance, as well as your movements and memories. There's a misconception that folks think that the brain health is only about being able to think about things and processing things, but there's two components to brain health. One is that mental abilities component, but the other part, and the more overlooked but the more impactful part, is the physical health of the brain itself. The brain is very plastic. It can change over the time. Oftentimes people think that when you're born, that's how many brain cells you have. That's not true. You're constantly growing new brain cells. The brain is very adaptable to what you ask of it. So if you do more of something, then your brain's going to get better at that. So it's very important that you understand the things that you can do to control some of these components to have your brain be as healthy as possible. If you're dealing with certain situations in life that make it harder to think or harder to move, you need to be very careful not to deprive your brain of opportunities to grow and to learn and to adapt to the challenges that you face every day. A little bit more about what the brain does. It drives everything that we do throughout the day. I guess, Mary, if you want to go into that a little bit more.
So going off of what John said, one of the biggest parts that we initially think about brain health is cognitive function. The 6 main components of that are going to be attention, executive function, learning and memory, perception, motor function, social cognition, and language. To explain a little bit more about those, attention is exactly what it sounds like, your ability to maintain attention in a conversation in a busy environment. Executive function are those higher level skills, your ability to make complex decisions, pivot your choices, and adapt to our changing environments that we deal with every day. Learning and memory is learning new skills, whether it's a new workout routine, a new language, or learning how to do a new hobby. Perception and motor function is your body's ability to move and understand what it's doing in our environment. Social cognition is your ability to interact with folks around you and to understand and read social situations. Language is your ability to speak and ability to understand when those are speaking to you. As John talked about, our brain controls not only cognitive functions, but also our body and the way it wants to move. One thing that we're going to talk a lot about tonight is our brain-body connection. And the biggest way to feed your brain is going to be through your heart. So what's good for your heart is going to be good for your brain.
And when we exercise, your heart pumps harder, right? So you breathe in the oxygen goes to your heart pumps that blood up to your brain receives that oxygen, and the brain needs oxygen. That's why if we get lightheaded, we pass out, because your body wants to be flat, get the blood to the brain. The whole idea is that your body's wired to ensure that there's oxygen going to the brain, and then if you do exercise and activity at a certain level, you're able to promote more blood flow to the brain, which then gets that brain oxygenated, which releases chemicals that can help the brain rewire and adapt. So whatever challenges you're facing throughout your day or your life, if you have that brain oxygenated, it's in a better state of doing what you need it to do. Like if it's in the winter months and you want to drive your car, you always start your car 10 minutes early so that the engine's warmed up. Technically, you can jump into that car and you can drive, but it's not going to perform as well as if you gave it that 10-minute warm-up. It's a similar concept with brain and exercise. The heart driving the health of the brain, because if you're exercising, it's getting more oxygenated, it's able to perform better, and if you're learning new tasks, you're going to learn them better, you're going to get memory retention better, and you're going to be able to see more results in your life. If you think about some of those chemicals that we talked about, or I just mentioned a moment ago, in terms of exercise, oxygenating the brain, those chemicals are like fertilizer for your brain. Sure, you can grow a tomato in your garden, but if you're not fertilizing the soil, it's not going to be as large and ripe when it's grown. Same thing with the brain. If you work on your exercise and you are getting those oxygen, if you're getting the blood oxygenating your brain, then you're going to have more chemicals in the brain to be able to improve your physical abilities, improve your memory, improve your cognition.
No matter where you're at in life's journey, exercise at the right intensity not only drives physical brain health, but also mental abilities. Those mental abilities are going to be those 6 core cognitive functions that we talked about earlier. Aspects of health that might impact your brain are going to be a sedentary lifestyle, stress, lack of sleep, poor nutrition, a high BMI. Any of those can contribute to a brain decline. Also, certain medical conditions like stroke, a traumatic brain injury, concussions, or certain movement disorders like Parkinson's or other age-related cognitive decline can also put you in a position where you find yourself thinking that a lot of this information is very useful for you.
Some of those risk factors you do have control over, like how you manage stress. Are you getting enough sleep in your day? Or are you eating the right things? Are you watching your weight? Those things you can manage. Are you active enough? Some of those other aspects that Mary mentioned, you may not have control over, but that doesn't mean that you can't do something about it. Again, like she said, no matter where you are, you will get benefit from being physically active, and it's important to be active at the right intensity. The power of movement cannot be understated. If you're moving around, going for a walk a little bit throughout the day, that's okay, but if you can step it up a little bit and hit a specific level of intensity, then that has been proven to drive brain health, not just in the physical, but also promoting those mental abilities. It helps promote the brain tissue that you have. It can help actually improve the brain tissue and brain connections that you have, and it can also potentially slow down any decline related to age. It's the number one thing that an individual can do and have control over to promote their brain health. Not only is it appropriate for individuals just looking to get better at, their job, but also if they're recovering from a stroke or if they want to learn a new language, exercise actually helps individuals learn new skills and preserve the skills that you're already doing. Not only that, but it can also decrease those risk factors that we talked about that are modifiable or that you have control over. You tend to sleep better when you get exercise. You have less stress. You have less likelihood of depression. Additionally, there are some health issues that you can actually stop or reverse, such as cardiovascular issues, stroke, or diabetes. Some of the things we talked about earlier in terms of the fertilizer, that's something called brain-derived neurotropic factors. Those are the chemicals that are released when you exercise. So if you want those tomatoes to be riper, you want to use that fertilizer. Another thing to consider is the neuroplasticity. That's the brain's ability to rewire and adjust itself based on the challenges that it's facing. If you're driving on the 90 and there's a lake effect snow and it blocks the 90, are you going to sit there and camp out all night, or are you going to get off the 90 and find another way to get home? I'm definitely going to be getting home. That's what the brain does. If there's an issue, if there's a blockage, you're going to find another way to solve the problem. Doing exercise allows you to be more plastic and to solve the problem, to be able to have better brain health and have those better mental abilities. So a little bit more about the anatomy of the brain so you can understand what exact tissues we're talking about. Putting a lot of emphasis in educating you about the physical health of your brain. So we think it's helpful that you understand what parts of the brain do what, so you have a working knowledge about what's going on up there in your head and what you do in your life impact it. So the first major part of the brain is the cerebral cortex. This is the large part of the brain that most people think about. And then when you go deeper into the brain here, you got the brain stem. That is where all the information is relayed up from the spine. And then right behind the brain stem is the cerebellum. It's the little brain, basically, and that processes everything that goes into the brain and out to the body. Some people can kind of think of if you drink a little too much and you get tipsy, that's the alcohol hitting the cerebellum, and so that's where your balance and coordination is. So no surprise that you lose a little balance and coordination when you have that alcohol. A little bit deeper into the brain is the hippocampus, which is right around here, not too far from the cerebellum. That's your main area for memory retention. That's the main hub that processes, what you experience, and then converting that to a short-term memory and long-term memories. Which again, back to the alcohol analogy, if you drink a little more, then you're more than just tipsy. You start to maybe not remember a lot of what happens, and that's kind of the alcohol going all around your brain and having an impact on the tissues. A little plug for those fertilizers, the chemicals released when you do activity, that has a positive impact. Just like alcohol, it crosses that blood-brain barrier and it's impacting a bunch of different parts of the tissue of the brain. The brain is very receptive to these chemicals, and so the brain-derived neurotrophic factor, that fertilizer for the brain, that has similar impacts, and it goes all over the place, and it can have a positive impact in the anatomy of your brain and can help brain health, the physical brain health, not just your mental abilities.
So some common areas that are affected by the brain health, as John said, is going to be balance, mood, memory, and all of those together are going to be impacting your functional independence. So to dive a little bit deeper, whether it's a traumatic event, a health condition, or regular age-related decline, if it's more of the cerebellum area that's being affected, you're going to see a deficit or starting to see troubles in balance, your ability to correct yourself, upright posture, all those kind of things. If you're seeing a decrease in thickness in an area of the hippocampus and the more inside area of the brain, you're going to start seeing that decline in memory, your ability to recall events, losing your keys, maybe not remembering the name of the person that you just met. Overall, your general mood is going to be affected a little bit more on the outside of the brain, more of the frontal lobe, not getting too specific, but all of those things together are going to impact your functional independence, your ability to do the things that you want to do, your ability to participate in social events, getting out and going shopping, remembering where you're driving. Some common health conditions that we don't necessarily have control over, but definitely impact our brain health, are going to be general aging, general cognitive decline, any type of neurologic injury such as a traumatic brain injury or a stroke, many different movement disorders, or even post-surgical or post-chemo memory loss. So we can address these things through physical activity at specific levels. Targeting these areas will help us prevent decline, will help us decrease the impact on brain cells and decrease nerve damage. And overall, the most important thing, a healthy brain is going to equal a healthy life.
And the more you use your brain, the better you're going to be, the better your brain health is going to be, not just your mental abilities, but the physical health of your brain and the brain tissues.
In 2019, I had a stroke, affected the right side of my body. I have really no use of my right hand, and I did not know where to turn, so I turned to Vivistin. I got my Vivistin at UBMS, and then I came to Buffalo Rehab Group after that. Things I've been able to do at home is I use a fork and knife at home. I turn a doorknob, and I'm doing a little shoveling and sweeping around the house. And I've also installed a hot water tank and a furnace in the last couple weeks.
This has all been so worth the hard work. Bill's able to participate in chores at home, hobbies at home. He put up the Christmas lights. Surprised me when I came home one day and he was able to use his right hand and put up the Christmas lights. So it means a lot to both of us.
I'm getting my life back at Buffalo Rehab Group.
Now we're going to go into more depth about those lifestyle impacts that you can have on your brain health and what they actually do and how you can manage them to maximize the value that you get out of different things that you can do to improve your brain health. The first thing, as we've said, is the physical activity. Cannot be understated. The things you do, how hard you work, that moderate level of intensity of activity that we're going to talk about in a moment, really changes the physiology of your brain. Specifically, the brain cells, they grow more, the neurons that connect those cells to help relay the information so that you can talk and move and balance those get stronger. Maintaining memories gets better. Specifically, how does this happen? So when you exercise, it releases those chemicals, that fertilizer, to help promote that brain growth. They actually can measure in the brain different parts of the brain. So for instance, this is the motor cortex. They see a thickening of that part of the brain with people that exercise more. And that's connected with being able to move better, move faster, be more stable. When we talked about the hippocampus, that's the center for the memory, they actually see in the hippocampus that there's a thickening of the hippocampus. So that's physical proof that your physical activity is driving brain health, the physical health of the brain, so that it can do more for you. Also preserving those brain cells, making sure that they stay oxygenated and that they have good blood supply. That's also extremely important. Another important factor is by doing that activity, we want to decrease inflammation in the brain. That messes with the brain's ability to rewire and build those connections. So when you exercise, that oxygenated blood gets up to those cells and the brain tissue, and it helps make sure that it stays not inflamed. And that can have a protective component as we age. There's a few other components which Mary will go into now.
So as John's talking about making all these new connections and laying all this fertilizer to create all these new skills inside the brain, it's very important that we also take note of the importance of sleep hygiene and stress management. Sleep hygiene is important because when you get into your deep sleep, REM sleep, that is the point in time that your brain is able to rest and recharge, and it really allows your brain to solidify all of those new connections. And then outside of that too, giving your brain a healthy diet to work from and to stay extremely hydrated is of utmost importance as well, because with all of this physical activity that you're doing, your body needs good fuel to run off of. To keep going with the mental health component and the cognitive component, not just sitting at your baseline crossword puzzles or reading your normal books that you always would. You need to challenge your brain. You need to find mental exercises that are going to target those 6 domains. Taking a new type of class, learning a new hobby, going out and exploring new social situations, anything that's going to really target all of those areas as well as the physical activity is what's going to help you get the most out of all of those lifestyle and brain health impacts.
And what you do drives the physiology, kind of tying it back together. If you use it, you will improve it. So if you're learning a new language or you're taking a new challenge, you're thinking about something different, your brain's going to change and you're going to get better at doing that skill that you're trying to do, or you're going to be able to preserve that activity that you like to sustain throughout your life. So now that we've gone into detail about the physiology and the physical makeup of the brain and what happens with the brain when you do exercise and activity at a specific level, and why it's important to challenge your brain cognitively to be as sharp as possible, we're here to give you a few tips and suggestions that you can incorporate into your daily life and your exercises to get the benefits that we've been explaining today. The first and foremost, as we've said, is the aerobic exercise. Can't emphasize it enough. That is the single best thing that you can do that improves your brain health, your mental abilities. It helps also with your sleep, your cardiovascular health. So what do you do to get that level of intensity up to be able to get those benefits? And it's moderate intensity aerobic exercise. And that can be in many different forms. The important thing is that the intensity matters. And you want to get your heart rate to at least 55 to 65% of your heart rate max, depending on your age. That's how there's a calculation to get that range in. Typically it'll be from 90 to 110 beats per minute. If that is something that's difficult for you to kind of understand or to get access to when you're being active, you can also think of a scale rate of perceived exertion where 0 is nothing, not doing anything, and 10 is your maximal effort. You want to be exercising aerobically at that 4 or 5 out of 10 range. You should be able to have a conversation with somebody, but you can't have multiple sentences like I'm doing right now, and you certainly can't sing. So you want to stay in that range. Going too hard may exhaust you more, make it more challenging. We want this to be accessible for you, so it's that 4 or 5 out of 10 effort range, or the 55 to 65% of your heart rate max. And again, that's specific to your age, so make sure that you're hitting that target range appropriately. Again, with the types of aerobic activity, you can do walking briskly in the neighborhood. You can use a treadmill, a bicycle, an erg. You can do swimming. You can do shoveling if the weather permits. Gardening rigorously, doing house chores quickly and actively. Bunch of different things, as long as your heart rate is getting elevated and you're feeling like that rate of exertion is that 4 or 5 out of 10 range. As it relates to activity trackers or heart rate monitors, there's a ton of cool tech out there. There's Apple Watches that have apps specifically designed to make sure you're in your target heart rate range, that you don't even have to think about it. You just look down and make sure that you're in your heart rate range. If you're too high, you slow it down a little bit. If you're too low, pick it up some. You can also have access to charts that lay out what that rate of perceived exertion is, that 4 or 5, that's that moderate intensity aerobic activity, and how it connects to the heart rate range. So that's a little bit of a deep dive into aerobic exercise. Again, you want to choose something that you like to do, because this is moderate intensity, and that's the importance of that you're hitting that level that's more than just easy. If you're having challenges with getting to those intensity levels, you can always have a personal trainer or therapist assist you on that path to make sure that you have access to this really important exercise. A second thing that you can consider to incorporate in your activities of daily life here would be strength training. We're talking 2 days a week of performing body exercises, strengthening the muscles. You want to be using multiple joints, 3 sets of 10 to 15 repetitions of an activity, where that last repetition, you really don't want to do another one. So for instance, if you're using your own body weight, we're talking push-ups or squats. We could do planks, you could do lunges, and you want to make sure that you're doing them in a way that 10th one, 11th, 12th, you really don't want to do another. That's the sweet spot. And they find that when you do that strength training, the muscles release chemicals. Again, those are those fertilizers that go to the brain that help promote that neuroplasticity, help promote that brain health. There's also, aside from body weight, you can also incorporate dumbbells or kettlebells, resistance bands, cables. The YMCA gym has a ton of extra resources there that you can use. It's just making sure you're finding something that's safe for you, that's accessible, that you know how to use to get that 3 sets of 10 to 15 repetitions of, say, 4 or 5 activities. Again, there's a lot of variability in there that I can't emphasize enough. Choose something that you find accessible, that's safe, that challenges you, that you want to do consistently.
So in addition to all those great things that John mentioned, infusing your day with really great daily habits such as a solid sleep schedule. Give your body and brain the ability to rest and recharge after your heavy-duty aerobic exercise and strength training. Making sure you're feeding in those aerobic activities to decrease your sedentary time. And overall, to a really good point to infuse into your daily life is mindfulness. Take a moment to do some deep breathing. Whether it's meditation or just bringing yourself back to the present, decreasing those cortisol levels in the brain are going to be key in keeping your brain healthy. Setting yourself up for success in anything that you're doing, whether it's a cooking task, baking with your grandkids, or doing things at work. You want to set up your work environment to decrease strain. Allow yourself to have the optimal level focus. Clear your countertops off a little bit, and then make sure you're taking breaks to refocus and recharge, to recenter yourself, to give yourself the best ability to maintain focus. In addition to that, we also still do want to have those cognitive challenges. Challenging your brain like you would challenge muscles is how you're going to grow your brain and your mental abilities to stay strong. The best way to kind of get all of these things together is what we call dual task training. Dual task training is taking cognitive functions and pairing it with aerobic exercise or strength training. Something that is probably the best example of that is a novel dance class or Zumba. Again, pick something new, pick something that you don't do every day. Even something as simple as listening to this course or a novel podcast while on a treadmill or a bike is going to challenge your brain and your body together. And then at the end, make sure you get a good night's sleep to solidify all those new things that you just learned. As John mentioned, the Y has a lot of great opportunities, and a whole wellness series that he's going to go a little bit more deep into.
Yeah, so this can be intimidating if you don't have a regular exercise routine. Again, like to review, it's the aerobic exercises, we reviewed that, strength training, the cognitive challenges, combining it all together to supercharge that brain, learning a new task or learning about this course, why you're on the treadmill or why you're on the bike. But some of the other aspects can be a little daunting. What's the heart rate range? What setting should I have the treadmill out? Is that stair stepper safe for me? The YMCA has a wellness orientation program that's specifically designed for you if you've got those questions in your mind. You see the value, you see that you want to preserve your brain health, you want to be able to do more, but I just don't know how to do it. The last thing I want is for you to do nothing after listening to us. So the YMCA, these are 4 classes every year that every YMCA member has access to that's already included in your membership. So the first one's going to be about getting a health assessment to kind of see where you're at. Then the second one is going to be, they're going to be setting goals to what kind of things you want to be doing. And if you're going and saying, hey, we just listened to this brain health talk, I want to do aerobic exercise, I want to do strength training, and I want to try one of these new classes to kind of challenge my brain. You know, what things can I do? So that personal trainer is going to work with you to get access to the resources that are the YMCA, help you schedule a class for Zumba, or help you understand the cable column so you can do the strength training, those 3 sets of 10 to 15 repetitions safely. Again, these are already included in your YMCA membership, and I strongly recommend you include them, that you take advantage of them because they're already paid for. If for some reason you do have a barrier that's stopping you from moving, or you have a previous ailment that may be not appropriate for a personal trainer to take on alone, we have physical and occupational therapy available at BRG that can help address those barriers and get you moving better. And we regularly work with the personal trainers to make sure that we're tailoring a program. So you come to therapy for a period of time, we get that barrier taken care of, and then you're back to the gym working with your personal trainer, interacting with your community. If you need more guidance for cognitive training, we have some resources for that as well.
So our PT and OTs that both have accessibility to this really great tool. It's called Creos. Creos allows us to do a personalized assessment of your cognition, and with those results we can take a good look at what we're seeing with the numbers and how that translates into real life, and then tailor fit a cognitive program paired with a aerobic or strengthening exercise routine to get you back to where you want to be at, full circle.
And you don't necessarily need to have something wrong with your cognition to get this. If you want to identify what areas of your cognition or your mental abilities are strong and you want to get them stronger, you can figure that out with this training. You can also figure out areas for improvement so that you can strengthen and preserve what you have, in addition to getting you back more physically active so that you can really supercharge the brain to make sure that you're staying as healthy as possible. So as we wrap up tonight's session, let's take a moment to review some key takeaways. It doesn't take big changes to make a difference in your brain health. Small adjustments like picking up a new hobby or taking a short walk each day can really help. But remember that physical activity at the right intensity level is essential for supporting your brain function, in addition to mindfulness and healthy habits. There are lots of valuable tools to get you going in the right direction, utilizing things like the YMCA's Wellness Orientation Program to get you started. And if you're looking for personalized care or having specific concerns about your brain health or function, we encourage you to schedule an appointment with us to dive deeper into what's best for you. Thank you for joining us tonight. We hope you've gained some useful strategies to support incorporating into your daily life. Stay tuned for our live question and answer session following this class, where we'll answer any questions you have on what we've discussed tonight.
What can Buffalo Rehab Group do for your brain health?
Hey, have you seen my keys?
Yeah, they were in the freezer.
The freezer? Man, my mind has been all over the place this week.
You telling me? I found your wallet in the trash.
Oh, thanks.
Look, why don't you go to Buffalo Rehab Group for neurologic care? With 13 locations across Western New York, expanded hours, and no referral required, it's never been easier to access the care you deserve.
Huh, I'll check it out.
Hi, thank you for watching the video. I hope you got some helpful information. And now we're going to transition to answering some of the questions we've received during the video. The first question is from Sanji. Is it true that the brain can renew its cells in a year? Will the recommendations you're making tonight help with that? The answer is yes. The cells are constantly renewing. There's new cell growth all the time. Big takeaway from the video is what you do in your life dictates how many cells are grown and what they're connected to make what activities you do during the day and during your life easier or more efficient, and how that impacts your memory and your physical abilities. Do you want anything to add?
No, I think that you hit a lot of it on the head. It's important to know that it's ever developing. Your brain is constantly capable of improving, and the time to start is now.
Next is from Shelby. Are there any vitamins that can be taken to help the brain health? I know that vitamin D is really helpful. I would also say daily supplements. It's not entirely in our scope of practice to be recommending nutritional recommendations. However, I'd consult with your primary care physician if you have specific questions. There's certain things about omega vitamins, omega fatty acids. There's certain Mediterranean diet, but again, those are.
That's a big one.
Yeah, so there's a lot out there. Just would be cautious on taking anything for face value. Do your research, get connected with a dietitian. I'd strongly recommend that if you have more questions related to that. Next is from Gary. What causes the frontal lobe to shrink? What are the ramifications of frontal lobe shrinkage? It sounds like there's some specifics related to that. The frontal lobe is basically your conscious thought. So me talking right now, I'm using a lot of my frontal lobe. Any impact to the frontal lobe would have some significant changes in a person's personality, control of their emotions, a lot of stuff, pretty much everything, right? Do you want to add any more?
Yeah, the frontal lobe is kind of a big ticket item, so to speak, when it comes to the brain. I see that you mentioned shrinkage. A lot of things can impact that. It can be traumatic brain injuries, certain types of progressive diseases. It doesn't just necessarily target an area and just start going full-fledged. There would be some specific diagnosis that would be attributed to that.
Yeah, and generally the brain can deteriorate over time, but again, the emphasis is there's a lot of control you have over the size of the brain and the tissue growth. And again, going back to that cell growth, what you do impacts your brain health. Thank you for the question. The next one is from Stephanie. What tools are available to establish a baseline for measuring progress in brain health? So first, with the physical activity is getting baseline awareness of what your heart rate range is and how you can exert yourself and what your physical capabilities are. That's definitely going to directly impact the physical health of your brain. Do you want to speak to the cognitive assessment, Mary?
So there are a bunch of different online tools available to do a quick at-home brain health assessment. In the clinic, we do have access to a few different types of standardized measures. Craos is one that we use a lot in the clinic. For establishing a true baseline, I would recommend coming in for an evaluation with one of our therapists.
Next question is from Elaine. Are there specific exercises to help bring blood flow to the brain? As we said before, aerobic exercise is the single best way to get blood flow to the brain. If it's healthy for the heart, it's healthy for the brain. They're directly related to each other. So I'd say definitely take the recommendations we discussed with the aerobic activity. And if you're concerned, again, talk to a personal trainer or a physical therapist, occupational therapist to get you on the right track for that. Next is from Sarah. If you have family history of Alzheimer's dementia, what can you do to get better outcomes? Everything that we've said today is 100% related to you and to anybody that has Alzheimer's dementia in their history. It's not like a guaranteed thing. You have a lot in your control. Being active, keeping your brain sharp, staying engaged, taking all the suggestions that Mary had in terms of making sure that you're as cognitively engaged in your life and your day will help with that. Anything to add with that?
I will say that if you do have a family history of certain diagnosis, time is always of the essence in being proactive versus reactive. So if you do have that information available that one of your loved ones does have that, getting in with one of us at BRG or talking to your primary is going to be the key first step.
Next is from Diane and Lori. I realize it's difficult to generalize, but how much time is better for strength training? How many days a week should you strength train? I would recommend 2 to 3 days a week of strength training. Again, you can do body weight activities. You can get more involved with machines and dumbbells if you know what you're doing and you don't have any physical restrictions, if you have access to that. As far as, so 2 to 3 times a week is what's recommended. But again, doing anything is better than not doing anything. Getting into a routine, just starting somewhere, and then seeking out support if you need it. Can anyone access Creos?
Creos is designed to be used with a therapist of some sort, specifically a physical therapist or an occupational therapist. It is not one of those free tools that I mentioned, but there are other ones that will produce similar results, but it won't give you exactly the same type of output. Again, coming in for a evaluation for cognition or any type of thing that you're worried about, that's something that we can always tack on and give you a good baseline.
Yeah, and it doesn't replace like from a medical doctor doing a cognitive assessment, but this is really helpful for physical occupational therapists to give you access to general awareness of where some of your strengths and opportunities to improve your cognitive abilities and how that relates to your physical performance and any diseases you may have or preventing diseases in the future. So it's a really helpful place to start. There are other things accessible. We don't want to do too many plugs here without doing our due diligence. There's a lot out there. Just be careful. Be informed consumers of what's available to you. Next question is, I was diagnosed at 56 with Parkinson's. What are the chances my daughters in their 20s will get it? That's a good question. I will say that Parkinson's, there's a lot in your control with Parkinson's. Please make sure that you're reaching out, staying as active as possible, the personal trainers, physical occupational therapy as early as possible to help preserve and improve your function. I'd recommend talking to your primary care doctor about that. It's implying some hereditary or genetic testing potentially, but again, outside of our scope of practice. So definitely talk to your doctor about that if that's a concern. Next question is, can I break down the recommended 150 minutes to suit my schedule? Yes, so I think that's in relation to the aerobic activity. So the recommendation is 150 minutes of moderate intensity aerobic exercise throughout the week. So you can break that down in any increment that makes sense for your life. Cindy's got one here. How much does alcohol play a role in brain damage? So I feel like every year it comes out that a little alcohol is good or 2 glasses of wine is okay. The most recent one I just read is the least amount of alcohol is best for you. There's really no benefit to brain health. I'd say minimize it as much as possible. Again, everybody has to let loose in some form or fashion and, to each their own. But nothing I read indicates that alcohol supports brain health. Sorry to disappoint. I think that's everything we have. I really appreciate your time. There's one more thing.
Run through the YMCA.
So sorry. So the YMCA Wellness Orientation, want to make sure that everybody's aware that there are 4 available personal training sessions available to you if you have to get connected with anybody for getting connected to the classes or getting oriented to the equipment. There's also additional wellness classes coming from BRG. I'm not sure what the dates are, but we'll be sending that out shortly. I think that's everything. So thank you for your time, and I hope you